Some of the statistics on the NHS at the moment are quite staggering. So a Commons Library report showed that NHS waiting lists for the treatment topped 7 million as of September 2022. That's up from just 2 million in 2010. We know that Keir Starmer's talked about his solutions for the NHS. We're going to be speaking to Wes Streeting about that soon. There's also other statistics to suggest that people are waiting a long time for treatment as well. So that Common Library report shows that now 45.2%, a new record high, are waiting for over 4 hours for treatment at A&E. This compares to less than 10% in 2011. What's the Westminster voting intention right now? Well, let's have a look at that, because obviously it's key critical to both parties to find out where they are in the polls. Well, the latest YouGov polling conducted on the 4th and 5th of January puts Labour 21 points ahead of the Tories, so they're on 46% versus 35%. And I suppose the key concern for a number of MPs, particularly Tories in marginal constituencies, is this notion that they are going to lose their seats and the NHS is going to be a key topic that's going to cost them on the doorstep. I think all of the polling consistently shows that it's the economy, stupid, as Bill Clinton's advisor once famously said, and the NHS that is really affecting people. We're waiting for Maria Caulfield to come down the line in Millbank. She's going to be with us shortly. Maria, I think, can join us now. Can you hear me, Minister?
I can, yes. Good morning.
Hello there, Minister. Thank you very much for joining us today. Look, you just heard me give all of those statistics about waiting lists. The Tories' record after 12 years on the NHS is appalling, isn't it?
Well, the UK government is only responsible for healthcare in England. These issues, whether it's ambulance waiting times or the number of beds available, are problems across the UK. So where Labour run the health service in Wales, they've actually got a worse performance in Wales. The SNP have similar problems in Scotland, and it's also the case in Northern Ireland. So, these are clinical indicators and factors, which means that we're under so much pressure this winter. We're seeing a twindemic of both COVID and flu. We're seeing over 50% increase in the number of patients in with flu at the moment. That has a knock-on effect if beds aren't available for A&E, which leads to the long waits which you describe, and then it has a knock-on effect on ambulances being stuck at A&E trying to unload their patients. So this winter is particularly difficult, and we've seen record levels of patients needing admission.
But Minister, just saying that it's bad across the whole of the UK doesn't help the Tories' cause. You've been in power for 12 years, and the NHS seems to be in a worse condition than it was when the Labour Party left it in 2011.
Well, that's my point. We are not responsible for healthcare across the UK. We're only responsible for healthcare in England. So all political parties, if they run, Labour run the health service in Wales, the SNP in Scotland, are facing exactly the same issues. But what we are doing,
it's England's numbers that are terrible, though, Minister, isn't
it? It's all numbers. Wales are in a worse position than we are, and certainly Scotland are probably on par with England, and that shows that there's clinical reasons for why we're facing these pressures. But what we are doing in England is we are creating 7,000 more beds by funding social care so that we can get patients out of hospital. In December alone, we were able to discharge over 8,000 patients who had been in hospital and were waiting to be discharged. We're opening new surgical hubs, over 90 across England, and over 90 new diagnostic centres. We're increasing the number of staff that's available as well. So there's a range of factors which are meaning that we are trying to tackle this problem.
OK, Minister, of those 40 new hospitals that Boris Johnson had promised, can you tell me where one has newly been built?
Yes, I can actually say next door to me in Brighton, we've had the new development that's almost finished. The other side of me in Eastbourne, they're going to be starting their new hospital fairly soon. And in addition to that, getting a new surgical hub, which will be completed by next year. The new hospital programme is between now and 2030. So there are some hospitals that won't have started, but there are some hospitals that are already finished, and hospitals where work has commenced. So we are serious about building those new hospitals. But that's in addition to the over 90 rapid diagnostic centres. Again, I've got one just on the edge of my constituency at the Amex Stadium in Falmer, and they're providing over 2 million new tests that patients can access that traditionally they would have had to go to the hospital for. So there's lots of investment going into the NHS that patients will start to see the difference from very soon.
But isn't it the timing issue, Minister, in the sense that patients don't feel they're seeing any difference? And the Telegraph reported in the week that only 7 hospitals, or work on 7 hospitals, had started out of the 40. You talk about staffing. We've got the NHS now being crippled by strikes. What's your position on the strikes as a former nurse? They put public safety in danger, don't they?
So the Secretary of State is meeting specifically with health unions tomorrow to discuss pay and conditions. Obviously, we don't want strike to go ahead. They do impact on patient care. They do make it more difficult for patients to get appointments, and that's why the Secretary of State is meeting with them to talk both pay and working conditions to see if we can make some progress on that. But the reality is we are putting record levels of investment into the NHS, and we want to make sure that that's going to frontline services so patients feel that benefit.
You talk about record levels of investment, but actually in the week, Rishi Sunak in his speech on Wednesday ruled out structural reform of the NHS. Why on earth would you pay more money into the NHS without reforming it, Minister?
Well, that's because we're putting money straight into frontline services right now. I've talked about the new hospitals that are being built, the new surgical hubs which are dealing with the backlog, so patients aren't waiting as long as they are at the moment to get their surgical procedures. We've got the new rapid diagnostic centres, so patients can go to a community centre in their local area to get things like MRIs, CTs, X-rays, where traditionally they would have had to wait for the hospital to send them an appointment. We've got 10,000 more nurses, we've got over 4,000 more doctors. The money is going to frontline services, and it will start to make a difference. This winter we're seeing huge numbers of flu, respiratory viruses, patients in with COVID that make it very, very difficult to see that difference. But we will get that. That's why the Prime Minister met with health leaders yesterday to see what more we can do so that patients can feel that benefit of that investment.
I know, although that Prime Ministerial meeting has been described as a talking shop. Minister, I know you used to be a nurse in the NHS. I know you got into trouble, I think, in 2017 for talking about scrapping that below inflation price cap on wages. What percentage rise would you give nurses? Would you give them the 19%? And as a former nurse, surely you'd be clamouring for that kind of figure.
Well, I still work as a nurse. That's on my declaration of interest, so you can check what shifts I do. And if I'm not elected again, I will be returning to full-time nursing. So no one is more passionate about nursing than me. But we also are in charge of the taxpayers' purse strings. And if we were to give a 19% pay rise, that's over £10 billion. I think the unions recognise that, and they're wanting to discuss pay with the Health Secretary tomorrow. So I think, progress.
What figure would you put on it then, Minister?
Start negotiations. Well, we're going to start negotiations with the unions tomorrow on this year's pay rise, and that will be submitted to the independent pay review body to see what they think, and that will look at things like inflation, staffing levels, retention. So I'm not going to make comment on what is going to be on the table at those discussions tomorrow. That's for the Secretary of State and for the unions to discuss.
OK, thank you very much for that. That's Minister Maria Caulfield. She's in the Health Department, and she's also, as she's pointed out, a nurse. And she will go back to nursing, she says, if she loses her seat come 2024.